Time for the Friday Night Roundtable featuring a newsmaker interview with Raul Grijalva, United States Representative from the 7th Congressional District of Arizona. Joining me on the Friday Night Roundtable, Sarah Garrett Gaston of the Arizona Daily Star, Jim Ninsel from the Tucson Weekly, and Linda Valdez of the Arizona Republic. Congressman Grijalva, thanks for being with us.
Thank you very much. Appreciate it.
Any second thoughts on your vote on health care, and what's the tone right now as we look back?
No, once 2 weeks before the vote, once I had said I'm going to vote for this, then we knew we couldn't get some of the things that we wanted in there, public option and in particular. But once the decision was made, it was a lot more than comfortable with it, and I could defend it.
What's the tone right now you're hearing from your constituents?
There's a palatable residue anger. Intense, and we hear that on the phone. But in terms of the constituency meetings, we've been concentrating on senior citizens because there's a lot of questions and a lot of misinformation that went to them, and veterans and small businesses. The questions are more specific. Initially there's the criticism, why did you do this? But then it's what it's going to do to my business, what it's going to do to my situation, what happens to Advantage that I have in Medicare. And then it gets much more specific, which is what we wanted to do, because we have something to defend now. In the past, we've basically been sent out here to defend a process, and that's impossible to do.
Congressman, I have a two-part question I'd
Sure.
like to ask you. The first part has to do with the murder of the rancher down in Cochise County. The people in that area are calling for more border security as a result of that. I'd like you to talk a little bit about what can be done immediately to help those folks feel more secure. The other question is a larger question about the continuing escalation of violence in the war between the Mexican government and the cartels. Things are getting worse and worse all the time, and there's speculation now that Nogales is going to be the next Juarez. And the United States is helping out Mexico, but much of what we're doing is more of the same. Do we need a different type of strategy to approach this?
Let me begin with your second question. I thought Secretary Clinton laid it out real well in her summit with the Mexican leadership about the border and about the violence. And indeed, it is a threat, a huge threat. And Nogales is being predicted as being the next hotspot in terms of violence and the movement of drugs out. That does not bode well for the region. But what Secretary Clinton said, we have to continue to provide the necessary support for the enforcement interdiction part of it, but we also have to begin to provide some support. And this is the first time Mexico has accepted this. They're very, very prideful of their sovereignty, have accepted some humanitarian development initiatives along the border, education, healthcare, economic development. And I think going two-pronged is the long term is the human infrastructure development. The short term, and it has to be intense, has to be really to begin to target that organized activity as the primary threat to the border and to not only American citizens, but Mexican citizens as well.
What about the demand side of it? They're in business and they're getting rich because Americans are buying those drugs.
And there's been a reluctance for us to talk about this issue. That it's one-sided. The violence is there, but the pull is here, and we can do a lot of things domestically to try to deal with that issue. But in the long term, it is going to have to be about how we approach the issue of drugs in this country. And we've done it as the war on drugs. So I think we need to redefine what we mean by our strategy domestically. Is it treatment? Is it early childhood education? Is it preventive? And we haven't done that part of it. It's been the war. And the wars, we've lost the war.
And the folks in Cochise County, what can they expect?
That was horrible. And Mr. Kentz was a real advocate in trying to save the Jaguar. We got to communicate with him on that. And it's tragic, and I agree with the outline that Ms. Giffords laid out: increased Border Patrol attention, more surveillance, more cooperative work with the folks on the law enforcement on the other side. I agree with all that. Short of, I don't think sending troops to the border is the long-term solution. But I thought her outline that she presented, absent that one area, which is a huge area, I support.
You mentioned reapproaching the war on drugs. What about decriminalization of marijuana?
I think that people need to begin to look at that. You know, it sounds, people don't want to say that, but, you know, part of the consumption issue is where do we concentrate our resources? And, you know, what's going to happen in California is going to have a sweeping effect across the nation. It's not only about decriminalization, it is also about being able to focus our attention where the real harm is. And the real harm is, and the real money is in the harder drugs that are easier to bring across the border, make huge profits, and that's where the cartels are more involved. It's the movement of cocaine. It's the movement of meth products. And, you know, marijuana, it continues to be a movement issue, but if part of it becomes a decriminalization, then the economic benefit from it won't be there, and the focus can be on where the real problem is.
I wanted to ask about spring training. Spring training ended in Tucson after many, many years, and some folks say that locating Tucson Electric Park where it is on Ajo was part of the problem. I'm just wondering, from your time on the Board of Supervisors through now, what is your perspective on that?
Hindsight is a wonderful thing. And in hindsight, we should have probably given in more to the person that owned the property downtown and tried to negotiate. He was asking for a lot of money, which made it prohibitive both for the county and the city at the time. And we thought that could be a development strategy to move it where it is. I'm disappointed that, but you can't control the corporate interest of baseball. And once some of the teams left up to Phoenix and Maricopa, transportation and other issues became the cost. How you convert those beautiful facilities into some major community use and other activities is going to be difficult, and I don't know how they do it. But in hindsight, yeah, probably should have been downtown. But if it was in downtown, we'd probably be talking about the same situation that we're talking about right now with a club moving out. But that's all one can rely on is hindsight at this point.
What can Congress do now that health care has passed? We've got the mid-year elections coming up. What is on the agenda? What becomes now the forefront item?
I think the fight for a majority is probably the key. You know, Republican Party wants a majority in the House and in the Senate, and we want to retain ours. I think that's going to be central. And many of the policies and laws and initiatives that we deal with are all going to be reflective of that strategy. And I think we need to push really hard on reauthorization of elementary and secondary education. I think that is important to the American people. And the sour taste of No Child Left Behind, we have an opportunity to cleanse that. Immigration. We want comprehensive immigration reform. The president is producing an outline. The Senate has an outline. I think at the very minimum that we deserve the debate and the public conversation about what that's going to be. The reluctance will be the exposure of that issue, what it causes to vulnerable members of our party, and what opportunities would be used politically to wedge that issue tremendously. It's a catch-20, excuse me. It's a catch-22 because if we don't move on that, a big base of the Democratic Party, the Latino community, is going to feel like one of the major pillars of commitments made for their votes was denied. Okay. And so how leadership walks that piece of ice is going to be interesting, but I think we should at least have that discussion.
I'd like to talk to you a little bit about those Latino voters because there's a lot of speculation about what they're going to do in November, what impact they're going to have. Do you have any kind of strategy for how to energize the Latino voter and get them to the polls?
I think one of the problems with the Democratic base, it's not just Latinos, you can see it in environmentalists and some of union folk and other kinds of activists, is that they feel that we haven't gone far enough in terms of initiatives. You know, when they said 59% of the people are opposed to the health care that initially that the Congress passed, 20+% of them were opposed to it because it didn't go far enough. And so let's just look at that 20%. And I think that's the challenge that we have, to re-energize it. And once we re-energize that base, I think we'll be fine. We'll hold on to our majority. In terms of the Latino majority, we have to respond to immigration. And I think the other key pillar, because 1 out of every 4 kids going into preschool right now is Hispanic. And so we have to respond to how you reshape public education to deal with this new demography. I think those two issues are critical to energizing the Latino vote.
The Obama administration is talking about loosening restrictions on drilling for oil. The Center for Biological Diversity said, short of sending Sarah Palin back to Alaska to personally club polar bear cubs to death, the Obama administration could not have come up with a more efficient extinction plan for polar bears. What do you think of that plan?
Before, during the comment period, and after the decision by the administration, there was an effort to try to balance energy needs with environmental needs. I don't think they met the standard in terms of environmental protection. And I just hope it doesn't take the momentum out of renewables and alternatives, because suddenly we're back in the business of using fossil fuels as the primary source of energy for our country. Those are the two things. I think it's Bristol Bay is out, great. The Pacific is out, great. But there's big pieces on the East Coast, huge pieces around Florida and the Gulf of Mexico, and parts in Alaska that continue, in my mind, to be endangered in terms of environmental impact that I think the administration overreached in that one, and we've been opposed from the beginning. And second of all, I just hope it doesn't rob us of the momentum that we have right now for alternatives and renewables.
I wanted to get back to healthcare reform for a moment. I saw your floor speech during that Sunday, and you mentioned things that hadn't really been in the forefront of the coverage, like Indian healthcare and things like that. I was wondering if you could elaborate a little bit for Arizonans who are so interested in these kind of things.
Three huge things that were not talked about, and that many of us fought really hard for. The entire Indian Healthcare Act is part of this package. It had not been reauthorized or renewed in 10 years. So the fact that that gets done for the 22 tribes, recognized tribes in this state, is huge. Construction, clinical development, prevention. I thought the initiatives that were also part of it, the prevention side is huge in this piece of legislation, dealing with issues of diabetes prevention, heart disease, obesity, huge, huge. And the last one is the community health centers. They're the biggest winners in this health package in terms of resources. And I think they will continue to provide that huge safety net that this community is going to need. So the El Rios, the Moranas, those kind of health clinics are going to do well here in this community as a consequence of that, and they become that other safety net that we're still going to need. We're still going to need in this community.
We have less than a minute to go. I just want a quick question about do you believe the healthcare debate be the major issue in the midterm elections, or do you think the economy will be?
I think the economy is going to be it. And I think healthcare, real quickly, it's a building block. And like Social Security and Medicare, we're going to come back and fix it. We're going to tweak it, make it better, add more to it. But it's a building block. And once people realize that it's a building block, I think that'll settle that issue down. I think it's going to be the economy. I think it's going to be about jobs and who gets blamed for it.
Okay, Congressman, thank you for being with us. Have a wonderful Easter weekend.
Very much.
Thank you for coming in.